I'm honored to introduce our next speaker. Jade Rivera McFarlane is the Vice President of Development and Community Relations at Gundera Center in Holyoke, Massachusetts. Gundera provides residential mental health, substance abuse, and preventative services for children, adults, and families across Pioneer Valley. It was founded in the Hispanic community and values cultural diversity and strives to provide culturally competent, innovative services for the diverse community that we serve. Jade Rivera McFarlane.
Hello, everyone. Again, I am Jade Rivera McFarlane and the Vice President of Development and Marketing for the Gundera Center. Those of you who may not be familiar with the Gundera Center, Gundera is a mental health provider with the mission of serving Hispanics and African Americans, as well as other underserved populations across the state of Massachusetts, with bilingual, culturally competent education and prevention services, as well as behavioral health services. Now, talking about substance use disorder and the opioid crisis, we wanted to dig a little deeper on really how it has affected our community here in Western Mass. So we have this iceberg, and I like to think of it like this because there's your stuff that's happening on the surface, and then when you dig a little bit deeper, which we will today, you'll see how there's a little bit more to the story. So across the state of Massachusetts, from 2016 to 2019, the state saw a 5% decrease in the total number of confirmed opioid-related deaths for all intents among Massachusetts residents. So if you take a closer look at that, you see the slight decrease, 5%, while there was still numbers, we did see overall across the state a decrease. However, that is the surface level. If you dig a little deeper, just below the surface, and you go town by town, you see that there was a notable increase in certain areas. So there were 9 cities and towns who experienced that notable increase in opioid-related deaths, related overdose deaths from 2018 to 2017. Now we look at those cities and towns, you can see that Chicopee, Holyoke, and Springfield were among those 9 cities and towns. Now, looking here at Chicopee, you can see that the increase were among residents, so people who live in the city of Chicopee. In Holyoke, it was in the number of occurrences, so people who may not be from Holyoke, but who overdosed in the city. In Springfield, there was an increase in both, so both the number of residents as well as occurrences within the city of Springfield. So again, of course, that's a concern to us being with Gundera, because the majority of our programs, while we do serve the entire state, we have a number of programs here in Western Massachusetts. So those are our largest cities here that we saw the noticeable increase, and we saw that stand out here in Western Massachusetts. Now, if we take a closer look, just a little bit further beneath the surface, we go location by location. Now you can see here, going back to 2014 to 2018, and you look at the number of opioid-related overdose deaths. So we have Springfield, Holyoke, and Chicopee here. You can see Springfield did a huge jump. So again, Springfield had the number of both residents and occurrence of overdose-related deaths in the city. So from 38 to 80, that's doubled the number that they had in the city. Chicopee had from 19 to 31. So again, a noticeable increase. While we see Holyoke did have an increase, it's not as large as the other 2 cities. Some theories are, the Peer Recovery Center that has been a Hope for Holyoke, which is run by the Gundera Center, having that program and having people being able to be saved has really helped out. We had some stories of people actually bringing people overdosing from in the community, bringing them to Hope for Holyoke because they knew that they would have Narcan and they would be able to help them there. Springfield just got their recovery center at the end of 2019. It's another center run by Gundera down on the Worthington Street in the downtown area of the city. So we're hoping that having that peer recovery center, just like in Holyoke, we might start to see these numbers go down. Now, if we go into the background of these overdose deaths within the cities in our area, you see, as far as race goes, the number of white or non-Hispanics was very high with 1,589. African American or Black non-Hispanics at 81. Asians or non-Hispanics at 20. Hispanics at 250. And those who are unknown at 36. Now, when we look at that, we see from 2017 to 2018, within a year, that you see the number of occurrences in the city increase amongst white or non-Hispanics to 94%. Among Hispanics, 177%. So you see the large number of increases, not only just among residents, but those that are coming to the city and overdosing. Now, if we look at the number of residents, it's even more disturbing. We see, white and non-Hispanic at 100% increase, and Hispanics doubled to 200%. So, it's very concerning for any race, but for the Gandara Center, who focuses in on the Hispanic population, to see that number double, it made us think and try to figure it out and to see what was the underlying cause of that. So in addition to race, we also look at age. And we'll go back to looking at the difference between the race in a second. Looking at age, you then see that the highest number of those who were confirmed overdose deaths due to opioids were between 25 and 34. And there is even a high number amongst those, right under that. It's concerning. So you see that the highest number is there in the middle ages, and as they go up, the numbers really don't come down. So thinking about that and thinking about the number of doubling Hispanics, we try to think and try to research and find different ways as to what was the underlying cause. Now, when we look at it, we actually realized we did some focus groups at our peer recovery centers. There was also a RAC study that was done in the cities of Chicopee and Springfield. And the number one thing that we learned, that stigma had a big part to play in it. Speaking to some of the people who are in active recovery or those who are still, going to treatment for substance use disorder, we learned that stigma not only kept them away from receiving treatment, but even going to informational sessions about Narcan. It had a little bit to do with their family. It had a lot to do with how their family or their religion viewed medically assisted treatment. And gathering all that information at churches, at our peer recovery centers, we realized how important stigma and the role that played in the number of overdose deaths that were occurring in our area. So talking about stigma, we not only did those focus groups, but we ended up finding a Hispanic family that was willing to talk to us and share their story about why it's so important to educate the community as a whole, but specifically within the Hispanic community, why stigma, what role stigma plays in people's overdose deaths, and how it can help by having the family be a part of it. So we're gonna show that video to you right now.
I pretty much grew up like a regular kid. My family was a middle-class Puerto Rican family, parents working really hard. But growing up, I just never felt like I belonged, as in I felt like I was different. There's something different with me. And I don't know what it was. So that's when I say I feel like I had this disease from the start. Before the drugs and alcohol, the end of high school, I'm starting to get into the wrong crowd, starting to smoke a lot more weed. Because before high school, I really didn't get introduced to those things. My outlet was sports and video games. I started going to EDM shows and more parties and whatnot, and I started to do a lot of drugs, and I started to do the party drugs, the ones that keep you up all night. And then I was introduced to opiates, and they're addicting. You know that you were told to never touch them. You know that if you do a certain amount, you're going to get addicted, but you don't know what the threshold is. You wake up one day and you're sick, and pretty much there's no going back from there. And I went from using pills to heroin and other street drugs, and I became an IV drug user, and my life just spiraled downhill. I got addicted.
When we first found out about Michael, it was very devastating because the first questions you ask is like, why? You didn't see that here. We didn't do that here. Why did you do that? But that's a stigma. That can occur to anybody. It's not just a certain type of person. It could be anyone.
I ended up in places that I never thought I would be. I ended up with people I thought I'd never hang out with. I ended up doing things I never thought I would do. It's just the nature of the disease, you know?
I visited him every Wednesday and every Sunday until he was let go through the court system. And now he says, Mom, you saved me, because if you would have bailed me, I would have ran.
I ended up doing the things I need to do. Started going to meetings. I started to meet people who were just like me. I started to hang out with people who were just like me, but who were sober and who were doing the right thing. I don't know. Something just clicked. It's not like this time around I wanted to be sober, or I thought I was I'm gonna get it this time. Like I didn't say that. I just said, I just have to hold out these 6 months and do what I need to do, and hopefully we'll go from there. And I took it day by day and one step at a time, and I got better. And as I got better, things started to get better. When I woke up from surgery, they told me that I'd never walk again. They told me that my foot would be a club foot, that I'd probably need like 10 more surgeries in the next couple of years. I'm not even guaranteed to keep my foot. Mind you, I'd be on pain meds for the rest of my life. Now I'm sober, 10 months to the day when this happened. And it was a lot. It was a big pill to swallow. Like, it really was. Things are going to happen in sobriety, and they're not going to be good, but you don't have to pick up a drink or a drug because they happen. And this is one of those things. Got some opinions, some second opinions on what I should do. They said I would have a better quality of life. I went with the amputation. Like a couple days later, the doctor came in. I said, I'm going with the amputation.
So it was an educated decision that he made.
Yeah.
Yeah. I mean, he really thought about it.
He said to us, I don't want to save it. He goes, I don't want I don't want all the extra problems, all the hip problems.
You don't want the multiple surgeries.
I don't want the multiple surgeries. I don't want all the opiates that I stopped taking. I know that I'm going to take it because I need it or I want it.
And that's what I did. And a month later, I was walking. It was something that I wasn't going to be able to do, they said. And I was doing it.
When he got discharged from rehab, he told me to throw away the prescriptions. He didn't want me to fill them. If he's in pain, he'll take Tylenol. He was a fighter.
A couple of months later, I was doing a lot of activities that I was doing before, just like driving, And I just kept moving forward, and I didn't look back.
I'm very, very proud of him. And I'm not ashamed of sharing his story, because he's not alone. I'm not alone. And if there's anyone that I can help get through it as a parent, I'm all for it. And I just say that God gave me my son back 10 times better.
I wouldn't have been able to do that without like the support system of my family or friends, because like when I woke up in that hospital bed, I had a room full of people that cared about me. And that's a big thing for us. Like, we have to feel like we're part of and feel loved,
People are going through things. We can't turn our backs. And some people might do that thinking that it's the best thing to do. But there's other ways to help. Don't give up on your kids. That's the worst thing you can do.
There's always hope.
There's always hope.
Without the family and friends and the support that I had, I don't think I'd be here today. Like, I literally had that support, and they kept coming back, and they told me I had this, and they told me, just keep moving forward, just keep looking forward, and keep trying to do what you do. It wasn't easy. It really wasn't easy. Like, my life today it still isn't easy, but I wake up every day and I do what I need to do, and I pray to God, and I thank him for the life that I have today.
So as you can see, the role that family plays in recovery is huge. And we shot this video both in English and in Spanish to show that, well, not necessarily show, but to teach people who are dealing with this, you can't necessarily just give up. Substance use disorder is an illness, just like cancer, just like, dementia, and it requires a certain amount of treatment. And when you're going through something like that, you need a support system. And I think that was one of the most important things that we learned, that stigma plays such a huge role, not only in people's recovery, but really in the number of deaths that we are seeing, specifically in the Hispanic community. When we had these focus groups, there was some people there that said, they didn't even tell their family that they were going through medically assisted treatment because their religion taught them that that was a drug as well, and it was just as bad. Or telling them that, they are not that person and they shouldn't be in a residential like those other people. But going through all of this and really talking to people who are going through it, we saw the role that stigma played, and how if we don't take the steps to teach people that substance use disorder is a disease, it'll continue to affect our community in this way.
Thank you, Jade, for that really amazing lecture. I think, the work that you and Gandhara have done to really identify and to address the inequities in substance use disorder have really been amazing for our community. Talking with folks, and thinking about some questions, one of the things, we have a lot of providers here who are interested in really incorporating treatment for substance use disorder, but maybe don't have quite as much experience. And I wonder, what advice would you give? You mentioned, this kind of different stigma, or maybe more stigma in persons of color with regards to treatment and other things. So what advice would you give to those providers for really addressing that in their patient population?
Sure. Yeah, I think it's very important to understand, one, the population you're working with. Being culturally competent and understanding that there is going to be a little bit more stigma if you're dealing with someone who's African American or Hispanic, and understanding where their family might be coming from, whether it's religious or just, like you said, just the stigma that comes along with it. So I think understanding that and making sure you may ask some different questions, and maybe ask them if family is supportive, or if they have another type of support group, a peer recovery center that's assisting them, because that's really what's going to help them get to the next step. As you can see in Michael's story, his family played pretty much the entire role. While he had his recovery, was already, some extra kinks were thrown in the plan with him being injured. If he didn't have his family there, I don't think the outcome would have been the same. And, we've talked to different groups, whether it's in the peer recovery center, like we said, with focus groups or even religious groups. And the stigma is there. It's very sad to see, not all of them, but some of them don't necessarily understand medically assisted treatment. They don't understand the recovery process, and they don't get that they have to be there and be a part of it. So I think them understanding that as a whole, and knowing that, it may be a little bit different with people of color, and to know what questions to ask and doing a little bit more research, I think that would make them more successful in treating people of color.
That's perfect. Thank you. These times are very different. And obviously for all of us, coronavirus has changed the way we practice. What have you seen in your community and in the clients that you work with? How has coronavirus changed substance use disorder and treatment?
But whenever I'm chatting with, our clinicians or those who work in our peer recovery centers in Springfield and Holyoke, or even out east for that matter, the big part of recovery is that communal part, right? The part that there's a community that's there to help you. And with COVID and the pandemic, we've had to isolate. And with people in recovery, isolation is like the worst thing that they can experience. So I know it's been difficult. The majority of our centers, actually all of our centers, have gone virtual. They have, on Facebook Live, they're still holding their groups. They're still doing all of their different programs that they would do and turning it into a virtual setting. However, it's still very different. I've talked to people at the centers. There have been overdoses, not only with people that we see, but really across the state. We're seeing an increase with everybody's dealing with mental health, whether you were dealing with it before COVID or after. And if you were, it makes it more difficult. So being that we've had to isolate people in recovery, it's, talking with the people who run our centers, that's the biggest thing. They really are struggling with that. And we are doing everything we can to make sure that we're in contact with them. But ultimately, it's difficult to be able to do that through the computer.
For those providers that work in the area who are interested in services and other things, what's the best way to contact you and your organization?
Absolutely. So if anyone's interested in our services, you can contact us via our website, gandharacenter.org, or give a call to our outpatient clinic that can connect you to any of our substance use disorder programs or any of our bilingual, culturally competent counseling programs. And the number is 413-736-0395.
Jade Rivera McFarland, thank you so much for talking with us today.
Thank you for having me.
Key points from the lecture include: the opioid epidemic has disproportionately impacted persons of color. Cultural beliefs and stigma regarding opioid use disorder may inhibit treatment. Resources like the Gandara Center can help to improve the care persons of color receive for substance use disorder.